Hello, my name is Nathaniel Tice. I've been a certified trainer since 2008. I got involved with the MAT and RTS community in 2011 after screwing my body up for well over a decade. And after getting into MAT, I started to find that these inhibited muscles and the weak links and identifying those weak links was 100% of the equation. Isolating inhibited muscles became a little bit more tedious as I was trying to work with various muscles throughout the spine. Essentially, that's a brief introduction into what we're going to be talking about today, which is this therapy bar. Essentially, it looks very simplistic and straightforward, and in a lot of ways it is. We really need some specific guidance if we want to get into greater detail on how this thing works and how well it can work. So essentially, I want to tell you a little bit of background on me. As I was playing with these various weak links, trying to get certain muscles in my body working, getting in tune to the sensations of these muscles that weren't working, I started to become obsessed with isometrics and identifying these weak links. Over the years, have come up with hundreds of thousands of different exercises to isolate anything from the toes to the neck. And what I really found was that when I was trying to work specific muscles of the trunk and spine, there's a big gap. We've got our isometrics, we've got our little motions to get these muscles moving, but then transitioning from the table potentially back onto the golf course or back to doing deadlifts or whatever type of physical activity we're involved in, there's a big gray area. There's not a lot of machines to isolate the multifidus versus the semispinalis versus the rotatorius. And again, when we're looking for guidance as to what we should feel in these motions, nobody's talking about it. Nobody really seems to have the type of understanding related to the mechanics of the spine to isolate these specific weak links. So, flash forward a few years, I'm working with a gentleman at the establishment that I'm at, and he is the traditional case of lots of issues. He had polio when he was a kid. This guy's about in his mid-70s. So he had his hip replaced as a result, all sorts of issues in his back. He had some surgery back there, and he was in rough shape, like most people who are dealing with that sort of problem. And as we're working with him, I'm finding everything in his back works pretty much the way that it ought to, or it's testing the way that we were looking for it, and it just seemed too good to be true. So we jump out to the gym, and we start playing with these various little motions, again, jumping from one machine to another apparatus, to another piece of equipment, to another set of bands, to another set of pulleys, trying to, again, distinguish between all these muscles. And he's telling me the things that I want to hear. Obliques are firing, erectors are working the way that we want them to, and then we get into kind of his transversospinalis area, and he's not feeling what we want. We jump back to the table, start to identify, oh yes, there is some weak links there. And to make a long story short, he had never even known, like most people, that these muscles in his spine weren't working, and that he needed to try and pay attention to them. So he tells me he's got a piece of equipment that he made years ago for golfing, and he just didn't really have the mechanical mindset to isolate the weak links that were contributing to some of the problems in his back. So essentially he shows me this therapy bar, and again, it does essentially look very straightforward. It's an aluminum bar with bunch of steel brass rivets in it attached to two bungees on some pulleys. And to somebody who doesn't know the mechanics of the spine, it's like a kettlebell. It's just potentially a paperweight if you don't know how to use it. But for individuals involved in the MAT and RTS community and trainers who just have a good knowledge of the anatomy of the spine and mechanics of those muscles, will start to find that this therapy bar is the single-handed most effective piece of equipment I've ever come across for isolating every single muscle of the trunk and spine. And one of the many things that's unique about the therapy bar is the oppositional pull on both sides of the bar. When we're doing our traditional wood chopping type of motions, you can see that when only one side of our body's getting resistance, after that 90 degrees is broken, that optimal force angle is lost. We'll go even further into our rotation. Now we're working side bend. Well, are we working side bend, or are we trying to work our rotation? So we see that even when we're doing these motions in the correct way with the type of guidance that we should, the force angles throughout the entire range of motion aren't optimal. When we've got a band pulling on both sides of this bar simultaneously, we never lose any of that rotational torque and the ideal angles to create the force we want on our spine throughout the entire range of motion, and at the end where we need it the most, because that's where everybody's vulnerabilities and weaknesses are at in general. Another really cool thing about this, again, is that gray area. So we're testing people's stuff on the table, we're looking at their spine, things are seemingly moving in the right direction, but what we see on the table isn't necessarily what they're going to be feeling in the gym when they get off the table and they start taking these muscles through their full range and end ranges of motion. So one of the things that's really cool about this therapy bar is the progression that can be made from the table again back into the real world, and that's always kind of the hard part. So this is a great tool that us rehabbers can use, and at the same time we're kind of some of the only individuals who can appreciate the complexity of the various muscles of the trunk and spine.